My name is Michael Seidman. I'm a medical doctor. I'm a surgeon. I'm a scientist. I've been funded from the National Institutes of Health and other institutions for years, and I direct the Center for Integrative Medicine at a very large health system. I've designed nutritional supplements for years because I just really didn't like what was out there, and I wanted alternatives. I want to talk to you about a problem that you all are familiar with, PMS. Both men and women are familiar with this, of course, premenstrual syndrome. If you suffer from the monthly symptoms of PMS, you're not alone. It's really an uncomfortable reality for about 75% of women who menstruate, with symptoms ranging from anxiety and depression to decreased sex drive, bloating, cramping. You know the story. The causes for PMS is interesting. It's believed to be provoked by the changing levels in estrogen and progesterone during the first 2 weeks before menstruation occurs, but nobody is 100% sure, but we think that's it. When you look at PMS relief, people take Motrin, they take different types of formulations, and I have looked at a lot of the different ingredients from an herbal standpoint, and we're very careful because we're GMP certified. Every ingredient that comes into our facility gets verified through HPLC, through certificate of analysis to verify that indeed what we say is in there is indeed in there. I want to go through some of the ingredients that are in the PMS formula that I've made that have made my wife and my daughter much more comfortable, made me a little happier as well, as you might imagine. And people have used this with great success. Black cohosh is one. It's long been used by Native Americans for its ability to relieve menstrual cramps. Dong Quai has been used in traditional Chinese and Native American medicine for centuries, and it's commonly used to treat cramps and pain during menstruation, as well as to ease some of the symptoms of menopause. Wild yam, sometimes known as Mexican yam, contains saponins, which can be converted to estrogen and progesterone-like compounds and thereby help diminish some of the symptoms of hormonal imbalances. Things like chaste tree berry, also known as Vitex, has been used since the beginning of civilization for a variety of ailments, and more recently it's used to relieve the symptoms of PMS because it helps to also balance hormones. Damiana is another herb that's been used as an aphrodisiac. It's also been used to relieve anxiety. And because of its progesterone receptor binding nature, the extract of Damiana is considered to help increase libido and may also help to ease the anxiety that accompanies PMS. Raspberry leaves have been used for years, thousands of years actually, for pregnant women who suffer from morning sickness and nausea. They've also been shown to help relieve menstrual pains. And for nearly 2,000 years, feverfew is an ingredient that's been helpful for preventing or reducing the side effects of migraine headaches, for example. And sometimes severe headaches can accompany PMS. So we've put together a PMS formula. It's an all-natural formula made in an FDA GMP certified facility. It has black cohosh extract. It has Dong Quai. It has chaste tree berry, all of the ingredients we had talked about. Generally speaking, what you do is you take 3 to 4 capsules at the beginning of ovulation and continue for 3 to 4 days after menses begins and as your symptoms dictate. I would always advise that you consult with your physician if you have an estrogen receptor positive cancer. You have to be careful with this. There is controversy with that. Generally speaking, I've spoken to some of the experts looking at soy, for example, in our menopause formula, and there is some evidence that if you have an estrogen receptor positive ovarian cancer, God forbid, or breast cancer, God forbid, they say you shouldn't use some of these phytoestrogen formulas, but that evidence is controversial. That being said, I'm not willing to risk your health, and I would like you to discuss this with your doctor if that's the case. Thank you very much for your attention. Hopefully you have a chance to watch some of our other programs. Have a healthy day.